The work that we're doing at the moment in modernising outpatient is quite transformational. We are working behind the scenes quite significantly with a large team of people to address what is quite an old-fashioned way of managing patients in an outpatient setting. We're trying to move to a more modernised service whereby we provide new technologies to give people access to consultant consultations via telephone and alternative media. This has required quite a lot of work with our team. Part of the reason we're looking at this is because traditionally there's a lot of failure to attend outpatient appointments, and for example over the last year between April and November there were 25,000 patients that failed to attend a follow-up appointment, of which 1,000 of those actually had failed to attend more than one appointment, and based on some of the figures that are quoted nationally at £157 loss of monies associated with the failure to attend, that equates to almost £4 million potential saving if we can remove those patients who fail to attend from the system. Of those 25,000 patients who failed to attend, there's a gap in the clinic, and so we need to make sure that we utilise those spaces for those patients who really do need to be seen and treated. And we really do need to sort this out because you cannot treat an empty seat. So the work that we're doing with that is to try and look at these patients. We've done some surveys, we've questioned 200 of our patients who failed to attend, to look at the reasons behind that. And we do acknowledge that within the administrative systems of our hospital there are some issues that we are trying to improve to ensure that patients get their letters in a timely manner, have the opportunity to contact us to change that if they need to, but also there are those patients that unfortunately do not attend for various reasons, and so this survey is hopefully going to give us some valuable information around that to help guide us move to an improved service into the future. Also, we're very keen to actually get some volunteers from our patients within the community to help us build a better service, and it's up to patients to really engage with that process to ensure that we can reduce the number of patients that fail to attend and fully understand the reasons behind that. So we'd be very welcome to have some volunteers to help us in managing that.